All right, here we go. Merry Christmas and Happy New Year. I hope everyone's having a wonderful vacation. I want to explain to you what we are going to be doing on this show for the next 2 weeks, Christmas week and the week of New Year's. For the next 2 weeks, we will be playing for you the most viewed episodes from the Liz Wheeler Show for 2025 and the most impactful episodes, the episodes that either made the biggest difference or that garnered the most media attention. And we are starting that today. So without further ado, if you would subscribe to the show before we get started, I would greatly appreciate that. You can go to youtube.com/Liz Wheeler, x.com/Liz_Wheeler, or we have video on Spotify now. You can find the censorship-free version of the show on Spotify just by searching The Liz Wheeler Show and hitting subscribe. Thank you to everyone who has been doing that. And without further ado, here is the best of The Liz Wheeler Show from 2025. All right, I'm very excited about our next guest. It's actually a guest that I promised you a couple of weeks ago that we would bring on the show. Just logistics took a little bit of time to get him on. He's here today, and I'm very excited to introduce you to him because it's a hot topic. Maybe the topic that you guys give me the most pushback on, but it does warrant a deeper discussion. Today's episode is sponsored by Kindred Harvest. You guys need to know what's in the tea that you drink every day. The Chinese tea industry has flooded America with products contaminated by microplastics and heavy metals. They certainly don't care about your health. They care about your wallet. Kindred Harvest is the American answer so that you can still drink the tea that you love. Third-party, lab-tested, zero microplastics, zero heavy metals, blended and packaged right here in the United States. No glue, no ink, no compromises. They have it all. Morning energy, evening herbal. It's clean tea for your entire family. I like the immunity tea. My husband likes the sleepy time tea. My 4-year-old daughter likes the caffeine-free cinnamon tea. Stop trusting China with your family's health. Choose American quality. Choose Kindred Harvest. Go to kindredharvest.co and use code Liz for 20% off. That's kindredharvest.co. Use code Liz for 20% off. All right. So my very special guest today is a physician. His name is Dr. Ken Finn, and he is the co-founder of the International Academy of the Science and Impacts of Cannabis. He's also the editor of Cannabis and Medicine, an evidence-based approach. And I want to bring him on the show today because whenever we talk about marijuana and cannabis, I listen to you guys. I hear what you're saying. I read the comments that you leave in the live chat. I look at the comments underneath the episode on Spotify and YouTube on X, and I hear what you're saying. A lot of you guys are U.S. military veterans, and some of you suffer from PTSD. And you tell me, you say, Liz, marijuana is part of how I handle my PTSD. It doesn't lead me to commit homicide. I don't suffer from psychosis. I don't have schizophrenia. What are you talking about? This is how I chill out. This is how I relax. This is how I treat my anxiety. And I hear what you're saying when you say that. However, while I hear you say that, I also read the evidence that shows me that what you're saying, while it might be anecdotally true, is not what the evidence shows by and large if you look at the entire data set of the impact of cannabis on our society at large. And I don't want you to just take my word for it. I don't want this to be a tit for tat, you telling me I don't know what I'm talking about because I'm not a veteran and I don't have PTSD, and me saying, well, here's the study, here's the science, this is what it shows, so you should change your behavior. I don't want that to be the dynamic. What I want is for us to have a deeper exploration into the science. And I want to talk to someone who, I reject the term the experts, but if there was an expert, this guy would be it. He has dedicated his career as a physician to this topic, the impacts and the science of cannabis. And so I want to bring him on now. Dr. Ken Finn, thank you for joining the show.
Thank you, Liz, for having me. I greatly appreciate it. And you hit a hot button with me. One of my triggers is big pharma. Not a big fan of big insurance. Our health care system is a disaster. And referring to the veterans, I practiced medicine in Colorado Springs for 30 years, which is a very highly military penetrant community. And I took care of a lot of veterans and their families, for thousands of them. And so I think our veterans deserve better. They truly do. And so I'm going to leave it up to you. You just kind of guide me down the path that you want to go. I'm more than happy to share my knowledge. I'm just a resource for you and happy to help educate.
Yeah, and I want everyone, too, that's watching, leave your comments, leave your questions. We want to incorporate as much viewer feedback into the show as possible. So there's a couple of topics that I want us to talk about. I want us to talk about some of the mass killers or the horrendous murders that have happened quite recently, or attempted murders that have happened quite recently in our country. So anyone from Irina Zarutska, we talked about her on the show yesterday, and of course we opened the show with that today. her killer, DeCarlos Brown Jr., I want to talk about him. I also want to talk about Robert Westman, the transgender identifying shooter who murdered 2 children at the Catholic school in Minnesota a couple of weeks ago. He worked at a cannabis dispensary. I want to talk about him. I also want to talk about Thomas Crooks. I mean, it's insane to me, and I know everyone watching agrees with this. It's insane that we don't know more about Thomas Crooks, the would-be assassin that tried to kill President Trump at that Butler, Pennsylvania rally on July 13th of last year. I want to talk about your evidence or your speculation. I want to talk about how cannabis or marijuana played into each one of these situations. I also want to talk about the studies that indicate that cannabis use, marijuana use does lead to psychosis and schizophrenia. It can lead to violence and homicide. Again, I ask everyone watching, listen with an open mind. And if you have, it could be anecdotal evidence, but if you have questions, if you have studies that contradict this, put them in the live chat. We want to see this. And I want to talk about, too, the impact that cannabis is having on children. So let's start first with the studies, because these are the points that I often make. Young men who smoke marijuana, you might think you're just smoking a joint with your friends. That increases your chance of psychosis and schizophrenia by 4 times. 4 times. And by 3 times for people who don't have any indication of those conditions before smoking for the first time. Can you talk to me about the science and your observations in that statistic specifically?
Well, right out of the gate, I'm going to be very clear. Not everybody that smokes a cigarette is going to get lung cancer. Not everybody that has a beer is going to get in a car crash or become a raging alcoholic. And not everybody that smokes marijuana or uses marijuana products is going to become a homicidal maniac. But the problem that we're seeing is this rise in potency in these products is contributing to a lot of these killings, mass shootings, stabbings that we're seeing in the news. And I don't know, I mean, psychosis is a very complex diagnosis. And the science is pretty clear that, and actually you referred to some of the studies in adolescents, there's an 11-fold increase of first episode psychosis in adolescents that are using. This is more recent data.
Wow.
In adult, 4 to 5 time increase versus psychosis. And marijuana, out of all substances, including PCP, cocaine, methamphetamine, alcohol, et cetera, has the highest conversion rate to psychosis than any other drug on the planet. So the cannabis psychosis is frightening. And there's no good predictor. I think if I were to summarize, it would be a young male with prior mental health problems is maybe more likely to develop a psychotic episode with using marijuana. And they don't have to, they could be a first time episode. It could be after chronic use and something tips the scales. It's a very complex neurobiological thing that occurs in the brain, which is the number one target organ. I mean, this is a centrally acting substance, just like alcohol and opioids. I mean, they all play very well in the sandbox together.
Yeah. And I think, I mean, it is important to note not everyone, and everyone watching knows this, because many people, like I said, we've had this conversation on an ongoing basis, and people say, someone said to me last time, I'm smoking right now and I'm not getting schizophrenia from it, which is a tongue-in-cheek comment here. But talk to me about some of these killers. You say that marijuana use or cannabis use, cannabis psychosis, cannabis-induced psychosis is playing a role in some of these violent crimes. Talk to me about some specifically. Robert Westman, the transgender identifying, it's a biological boy. He identified as a girl named Robin. We don't call him Robin on this show because, we are on team reality here. We come to find out later that Robert Westman worked at a cannabis dispensary. I mean, talk to me about this what's your take on this?
Well, as it relates to these things, I mean, remember, one very classic example people tend to forget is the American hero, Chris Kyle. He was a veteran, and he and his friend were murdered by another veteran, Eddie Ray Routh, who was self-medicating with cannabis and had cannabis-induced psychosis. I mean, I spoke to the forensic psychologist that testified at Eddie's trial. I spoke to the Texas Ranger that testified at Eddie's trial. He wasn't insane. He had cannabis-induced psychosis, and he was a veteran. So I think our veterans deserve better. And I think we need to follow science needs to guide policy, not public opinion or anecdotal stories. I mean, having taken care of a lot of veterans in my career, I can tell you I've got a bag of anecdotes that tell me that patients say it doesn't help for whatever ails them, that they use it for other reasons rather than pain relief or PTSD. And the medical base, the literature base, is very clear that it doesn't really help with these types of problems, PTSD in particular. And if you circling back to Robert Westman, I mean, the dispensary he worked at, in the job description, he was required to use product and test product. So, and there was a study out of Colorado looking at the dispensary the cannabis dispensary workers, and they tended to use before, during, and after work. So they were probably
Jeez.
chronic users. And I'm more than happy to share that paper with you. I just reviewed it the other day because I'm presenting to the Texas Pain Society coming up, and one of my big topics is going to be cannabis psychosis. And I actually been compiling a lot of examples of mass shootings, beheadings, mutilations, driving fatalities, stabbings that all circulate around THC only. I mean, I look at these cases individually, and I get rid of the ones that have THC plus alcohol, THC plus other substances, because there's a lot of polysubstance use going on in our country. We are a narco nation at this point. That I really think it's important that the general public understands the public health implications of simply another addiction for profit industry that is causing societal effects. I mean, we haven't done a good job with the legal drugs we already have. Look
Yeah.
at tobacco and alcohol. They're terrible. They kill hundreds of thousands of people every year. And now marijuana is just following the same playbook.
Yeah, well, that's also, if you could speak to this, this is one of the comments that we get pretty frequently whenever we talk about this is, okay, Liz, now do alcohol. You know, if you say that marijuana is so dangerous or cannabis leads to psychosis and it has a detrimental impact on our society, what about alcohol? Do you want that banned too? If you could tell me the science behind, and maybe it's the cannabis induced psychosis that doesn't happen with alcohol. Maybe there is psychosis that happens with alcohol, but what is, I guess, the difference in the chemical reactions that happen as a result of those two substances, and why is cannabis more severe, or is it more severe than alcohol?
Well, all substances can convert to psychosis, which includes alcohol. And as I mentioned earlier, cannabis has the highest conversion rate to psychosis than any substance, including alcohol. And it's very challenging to compare alcohol to marijuana because they are apples and oranges. Alcohol is water soluble. It's kind of in your system, out of your system. It's metabolized by the liver. It's excreted in the urine. It's easy to follow the impairment. You know, 0.08 BAC, blood alcohol content, is impaired. Marijuana, on the other hand, is completely different. It's fat soluble, not water soluble. It ends up residing in fatty tissues, and one of the biggest fatty tissues in our body is the brain. So it can accumulate over time. So you cannot pivot and say, well, what about alcohol? Well, that ship left years ago. That's a battle I don't want to fight because that ship's gone. You know, the marijuana boat is still in the harbor. We have time to address the public health implications surrounding marijuana in terms of a variety of things. You've got suicidality, depression, PTSD, violence, psychosis. You have hearts on the cardiovascular system. You've got, heart attacks, sudden death, stroke, all these other health implications. I published a paper in Colorado. One hospital lost $20 million in 6 years just from marijuana-related ER visits. And if you take that across the state of Colorado, that's hypothetically a $500 million price tag in 6 years. This is just, our state leaders sometimes can't spell P&L. They always talk about how much money they're making. They never talk about the societal costs. And if you talk to any parent that has lost a child or a loved one from cannabis, either from suicide, other drug use, because it is a gateway drug, homelessness, etc. I mean, this will tear a family apart, just like any other substance. I mean, they all play well in the sandbox, and THC tends to be this little schoolgirl that nobody asks to the dance, but she's always at the dance, always, somewhere.
This is the first time that I've heard anybody say what you just said, which is one of the difference chemically between alcohol and cannabis is that alcohol is water soluble and the body processes it out. Not that it can't lead to, obviously, problems, addiction or psychosis, but that cannabis resides in fat cells, especially the brain. So does that mean that it builds up differently than alcohol, meaning Absolutely. It can lead to psychosis in like a cumulative way that is not true for alcohol?
More likely than not, yes. And there was a very recent paper that I think it was the most succinct medical paper on describing the neurobiology surrounding cannabis use and the development of use disorder, which is now about 30% related to the increasing impotency, and also how the brain, the kind of the mechanisms in the brain on how it leads to psychosis. So there's actually a biological reason how people develop psychosis. It's a very complex process inside the brain, and psychosis is a very complex diagnosis.
Mhm.
There's other factors than just substance. There's genetic predisposition. There's environmental factors. So there's all these things that can come together in one episode. Like, for example, Bren Specher. I don't know if you're familiar with her. She was a young woman, very smart, PhD audiologist. I didn't realize how much schooling they have to be an audiologist. And she took 2 hits off of a bong and then became acutely psychotic and stabbed her friend 108 times.
What?
Killed him. Oh yeah, she served no time. She served no time, and she was on Dr. Phil. There was 2 one-hour episodes on Dr. Phil of her describing her psychotic experience, and it's actually frightening. She was stabbing herself in the neck, and I was, I don't know, fortunate or unfortunate enough to actually see the body cam video, and it's frightening to see this poor woman who became acutely psychotic, and they said, well, it's an adverse childhood experience. No, there was a very strong temporal relationship between use and onset of event, and it was acute. It happened like right away. She became acutely psychotic and stabbed her friend, killed him 108 times with 2 knives. Police officers had to use a baton to break her wrist to let go of the knife. I mean, psychosis is frightening. Any substance-induced psychosis can be frightening. But a friend of mine who's a forensic psychiatrist told me after 40 years of practicing psychiatry, the people that scared her the most were the ones with cannabis psychosis. And I was very surprised. I'm like, what? It's supposed to chill you out, make you mellow,
Yeah.
right? But
Munchy.
punchy, yeah, just kind of couch locked if you use the indica, very strong products. But she said no, the cannabis psychosis patients were the most violent patients she ever had to take care of all the substance-induced psychosis patients she's ever seen.
Wow. I mean, it's shocking in one sense.
Frightening because I speak a lot to medical communities. I mean, I speak internationally. I'm the founder of this International Academy in the Science and Impacts of Cannabis. And actually, at the end of the month, we have Sir Robin Murray from the UK speaking to us on this increase in cannabis psychosis. And I'm more than happy to send you the link. You can share it. I'll be moderating that talk. He was the world leader and researcher on cannabis psychosis and set up the first cannabis psychosis clinic on the planet in London at King's College. He's going to be speaking to us on cannabis psychosis. So, I mean, these cases are frightening. They're very horrific. I mean, I have examples of mass shootings, stabbings, beheadings, mutilations, all surrounding the use of cannabis. And
let me ask you this:
yes.
when you talk about cannabis psychosis, and you describe this woman who stabbed her friend 108 times, then wasn't sent to prison and was on Dr. Phil. I have not heard this story. I have not watched those episodes. I probably will after this, and I think a lot of people watching, sitting here with us today, probably will look that up afterwards too. Yep. Is cannabis psychosis something that is temporary? Meaning, once you detox the cannabis out of your system, does it go away, or does it cause some kind of permanent brain damage that, once you've crossed that line, you're addled for life?
That is a great question. Number one, most people that use will not develop psychosis. Number two, if you do develop psychosis, most of the time it'll resolve once the substance is processed out of the body. However, there are cases where the psychosis can persist for weeks, months, and sometimes never goes away. That sometimes is a bridge you cannot uncross. And schizophrenia, you mentioned earlier, is kind of on that spectrum of psychoses. It's kind of the worst of the worst psychoses. And there was one of our advisors at Isaac from Denmark published a very nice paper, 50 years, 6 million Danish citizens. And they concluded that nearly 30% of schizophrenics in the country of Denmark would not have been schizophrenic if they had stopped using marijuana.
30%?
Up to 30% of schizophrenics
Holy moly.
in the country of Denmark would not be schizophrenic if they averted cannabis use disorder. And this is a large study. This is 6 million people over 50 years.
Today's episode, by the way, is sponsored by All Family Pharmacy, one of my favorite partners here, because let's be honest, most big chain pharmacies do not care about your medical freedom. My medical freedom is of utmost importance to me. I know you share this worldview. And most big chain pharmacies, they just want you to get in line and take their shot. That's how they profit and then move on. I am not cool with that experience. Well, all I want is when I need a medication to be able to get it. Literally, that's it. It's that simple. And that is why I'm proud to partner with All Family Pharmacy, because they are here to respect. They exist because of our medical freedom, because they respect our medical freedom. And this is how they work. They operate completely differently than big med pharmacies. They believe that your health decisions should stay between you and your doctor, not dictated by some government agency or insurance company. This is how they work. You pull up their website, allfamilypharmacy.com/Liz. You can do this right now. You search your medication. They have over 200 options, so they're going to have what you want and need, what works for you. And then you place your order. After you place your order, a doctor reviews your order, writes you a prescription. It's shipped straight to your door. That's it. That is all there is to it. The gatekeeping that has overtaken our healthcare system is outrageous. No, it shouldn't be Dr. Fauci or Albert Bourla or the American Medical Association or your insurance company who decides what medication works for you and whether or not you should be allowed to have access to it. You should decide. That's what medical freedom means. Go to allfamilypharmacy.com/Liz. Use my code Liz10 for 10% off. Go to allfamilypharmacy.com/Liz, promo code Liz10. Even if you don't need medication now, they're a great resource. Visit their website now so that you understand how to rely on them in the future. allfamilypharmacy.com/Liz, promo code Liz.
And
that brings me to the story that we talked about yesterday. I mean, that's mind-boggling. 30%. And by the way, in the United States, this is you could probably extrapolate this to Denmark, but this is just in the United States. Of homicides in the United States, between 3 and 10% of those homicides are committed by people with schizophrenia. So you put those two data sets together, that's the societal impact is pretty clear, even if you're someone who's used marijuana and, it did not develop into psychosis. I don't know how you deny that. It also brings us to, DeCarlos Brown Jr. He was 34. He was 34 years old, or he's 34 years old. He diagnosed with schizophrenia, I think 4 years ago, before he stabbed Irina Zarutska on the bus on August 22nd. I have not seen as yet any hard evidence that DeCarlos Brown Jr. was, high at the time or that he was a cannabis user. My speculation, I suspect that's what we would find out if we had a toxicology report. What do you see in that case?
Actually, that's a very interesting case. I've been looking at this closely. I mean, he kind of fits the bill of potentially having cannabis psychosis. And again, if they drug tested him, he probably would be negative. And that's the thing that that's what makes cannabis, in my opinion, so covert and insidious, is that you can have an event and they will test and it's not in the blood because it is literally out of the blood in 4 to 6 hours. So if you do not get that blood in a certain period of time, it'll be negative. And people are like, well, there's nothing in the system. Well, then you test the urine. And a lot of, trust me, I've been trying to get FOIA requests on a lot of these cases. And a lot of times they just stop at alcohol. I mean, even the state of Maryland does not test for cannabis in anything other than a driving fatality. They'll test for Benadryl, but they will not test for cannabis. So if you don't get the blood in time, if you don't get the urine in time, you need to get the hair. And we can talk about the Trump shooter, Thomas.
Yeah, let's.
And we in a second, we definitely will talk about that. But a lot of times the coroners will not get the appropriate samples. And like I said earlier, the cannabis psychosis can persist. And the schizophrenia data from Denmark is very telling that frequent cannabis use may lead to a significant increase in the risk of schizophrenia. We know there's an increased risk of psychosis, and schizophrenia is on that spectrum of psychosis. And people say, well, correlation doesn't meet causation. You get that argument all the time. But the same author from that paper did a very nice outline linking the causal relationship between cannabis use and psychosis, which again, schizophrenia is on the spectrum. And he used what's called the Bradford-Hill criteria, which was the same criteria used in the 70s to link nicotine to lung cancer. They used what's called the Bradford-Hill criteria. And Karsten from Denmark used the same criteria, Bradford-Hill, and demonstrated the causal relationship between cannabis use and psychosis. And we know all the other data shows the fourfold increased risk, 5-fold increased risk, and in adolescents, 11-time increased risk of psychosis, first-time episode psychosis with cannabis use. So, I mean, the waters are a little muddy, but they're getting more clear over time. And as it relates to Thomas Crooks, I mean, that was an absolute disaster. And I've reached out to so many people on that. I have his toxicology report. I have his heavy metal screen report. He was negative for THC, right? But the Allegheny Medical Examiner website is very proud of the fact that they had over 6,000 drug tests, and most of them were fentanyl, cocaine, and cannabis sativa, right? But they did not even test for cannabis. They didn't even test for it. So that was red flag number one.
Wait, and Thomas, I want to make sure I understand this. In Thomas Crooks, he was not tested?
Nope. He wasn't tested for THC. Although, even though the Allegheny Medical Examiner website says we are proud that we test, and we had 6,000 positives for fentanyl, crack cocaine, and cannabis on their website. And I can send you that information.
So they have the test. They just didn't test Thomas Crooks.
They did not test Thomas Crooks, although that seems to go against their typical protocol. And I went back and forth with the Allegheny Medical Examiner. I said, you need to retest. They actually kept the hair, right? And I said, retest the blood, the urine, and the hair, please. And if it's negative, I don't care. If it's negative, it's fine. It's negative. But if it's positive, we just simply have another cannabis-related shooting on our hands. And the other red flag, number 2, was he was a 20-year-old man with an elevated lead level in his blood. That is very weird for somebody that age.
What does that indicate?
Well, the data, the medical literature shows that chronic users have higher levels of lead and cadmium in their blood and urine.
Chronic cannabis users.
Yes. Cannabis is
interesting.
Soil remediate, and I can send you the paper on that as well. So we were saying, okay, well, you have a young man with elevated lead levels, so that might suggest cannabis use, right? Doesn't prove it, but may suggest it. It's weird for somebody that age to have elevated lead levels, right?
Yeah.
Number 2, the medical examiner didn't even test for cannabis, even though they typically do test for cannabis. So why did they go against their own protocol?
Yeah, why?
I don't know.
Not rhetorically, why?
They never responded to me. They punted to the FBI. And when I called the FBI and I said, look, they will destroy any evidence after 1 year because they are required to maintain the samples. As of July 13th of this year, those samples are probably destroyed.
You're kidding. So we don't have his hair anymore?
I don't know. That nobody will respond to me. And when I talked to the FBI, they hung up on me.
Wow.
Right.
Wow. So I think everyone watching this show right now probably feels the same way that I do, and feels that investigation into Trump's would-be assassin was never done even close to correctly, and it cannot be explained away by mere incompetence of government employees. Like, there's something there that is shady and weird, and this just adds to it. Especially if it was... Go ahead.
Nobody would listen to me. I mean, we have the data, we have the evidence, and we can't prove anything. All we asked is just retest it. Just get the samples. And I try to get FBI to get in, and they hung up on me. I reached out to every news outlet that I could. This 4 or 5 months of my life spent trying to get somebody to get those samples and retest it. And I don't trust the Allegheny Medical Examiner to have done it themselves. They would have said, well, it's negative. I would want independent testing. But, this is our president. Whether you like him or not, he got a crappy deal. He got a bad deal on testing of somebody that tried to take his life. And if it was a loved one, a family member of yours or mine, we would want no stone unturned. I mean, maybe he was on antipsychotic medication, but that didn't show up in his system. But they just did not test for something they normally test for. So what's with that?
That is awful. It's really, I think it's so discouraging, actually. Obviously, I sit here as a skeptic of all government employees, and I have sort of a tongue-in-cheek comment that I make, although I guess I am not really joking. It's kind of joking when I say it. I kind of mean it when I say on principle I dislike every politician, no matter what party they're in. Because of stuff like this. It is so discouraging to sit here and think you just can't have faith in the people that are running our government at any level. And it's really demoralizing. You sent me a statistic I want to ask you about, though. You said, because this is, again, it's I think, different than what people are going to be expecting. And the immediate knee-jerk reaction would be to push back on this statistic. You said cannabis is more addictive than opioids in early onset users. Can you explain this to me and tell me not only what you mean, but the science behind this?
I'm a pain physician. And I take care of people that have a lot of pain disorders. And, we're in the middle of an opioid crisis. We try to get people off their opioids. I mean, I don't like the term pain management because it implicates medications, but that's not what we do. We evaluate patients for, whatever condition they may have with physical therapy, chiropractic, acupuncture, whatever. Medications are sometimes part of the treatment plan. And there are some people that take opioids chronically, but they're monitored. And interestingly, the opioid crisis worsened under the umbrella of marijuana program expansion in our country. Finally, and thankfully, based on CDC data, the opioid overdose deaths are finally on the decline. But during 2005 to 2020 plus, more states were legalizing, and our drug crisis got worse under that, even though they said, well, it's going to marijuana is going to alleviate our drug crisis, but it actually worsened under these programs or crises worsened. I published a paper that fentanyl death rates were actually worse in marijuana states compared to the states that didn't have marijuana. So on this particular paper, as a pain physician, I was very surprised. It was an American Academy of Pediatrics paper that showed early onset users from 11 to 17 years of age, comparing them to, 11 to 17 using marijuana and 11 to 17 using opioids. After about 1 year, they had a very similar addiction rate of about 7%. 3 years after use, the marijuana users had twice the addiction rate than the opioid users 3 years later. And as a pain physician, I was very surprised. I would have bet dollars to donuts that opioids were more addictive than cannabis in those early onset users. And if you take the later onset users, 18 to 25 years of age, comparing marijuana to opioids, those later onset users had also a very similar addiction rate to each substance a year later, lower than the earlier onset users. But even 3 years later, those late onset users still had a higher addiction in the cannabis category than the opioid category. I was surprised. And this is not just me pontificating. This is American Academy of Pediatrics paper.
Yeah, I am surprised too, actually. That's why I wanted to ask you about that, because I mean, everyone sitting here with us knows I've explained my thought process. When I entered conservative politics a decade and a half ago, I was pretty libertarian minded. And I was like, listen, I wouldn't smoke pot, but like, you want to, I guess it's your right. What right does the government have to get involved in what you're going to do? I wouldn't necessarily vote for legalization, but like, why? You look at it through a libertarian mindset. And that was my viewpoint like 10 or 15 years ago. And I've had a very big worldview change. And it started actually with reading Alex Berenson's book, Tell Your Children, because he makes the case using evidence-only studies. He makes the case that the marijuana lobby, I mean, they're making a lot of money on both quote-unquote medical marijuana, but also recreational marijuana, that the marijuana lobby essentially pulled a snow job on all of us by normalizing it and making it seem like this is medicinal to take the stigma away from it. And then, making it, then their goal was always to make it recreational. And they bought off physicians and doctors and journals and researchers, and their stats are doctored. And I found it very convincing because Alex Berenson wrote the book. He tells the story, I think, in the book. He's definitely told it to me personally when we've been talking. But he said the reason he wrote the book is because his wife is a doctor who would come home from working. I think she was an emergency room physician. She'd come home from working and would tell him about these cases, these violent cases, the psychosis cases, the schizophrenia. And she'd say, it's always cannabis users. And he scoffed at that. And he said, what are you talking about? Marijuana makes you chill and munchy. People just use it to be cool. And she's like, no, I tell you, this is it. And he actually set out just to prove her wrong, because that's what, nerds do, nerdy husbands and wives, research to make a point. And he realized that the studies and the evidence actually proved her experience to be correct and his preconceived bias to be incorrect, which I find to be really interesting, because I think a lot of us have had a similar experience that, we were actually sort of subject to that propaganda and we believed it because it was plausible. And now we're realizing the societal impacts. And some of this data is just downright surprising based on how it contradicts what we were told. Which leads me to what I want to ask you. Earlier, we were talking about Robert Westman, the trans-identifying Minnesota shooter, and you also sent me a stat that for transgender identifying individuals, you said there are studies that show that they're more likely to both use cannabis and commit suicide. Are those two things correlated in your opinion? Can you elaborate on this? Like, talk to us about this statistic.
They're strongly correlated. And it's interesting. I mean, this is just my own speculation. The cannabis plant is very complex. I mean, there's hundreds of components to the plant. And there was a guy by the name of Robert Pertwee, I believe. He wrote a book on the science of cannabinoids. And in that book, there was some evidence that some of the cannabinoids may mimic female hormones. So this is completely speculative. So in this day and age of gender confusion, and in this day and age of increasing marijuana use, is there something to that, of this feminization, perhaps because of the estrogenic type of cannabinoids that may be in the plant? I mean, the old saying is "doobies make boobies."
I've never heard that, actually.
There's some debate as to whether that may be the case. There's a condition called gynecomastia, which is in a breast enlargement in men. So some of the cannabinoids actually have estrogenic-like components. I had plastic surgeons in Colorado Springs tell me that they had a significant increase in young men requesting breast reduction surgery because they would not stop smoking their marijuana, and they had the wherewithal to afford breast reduction surgery. I mean, these are the things that people don't really connect the dots. And again, this is completely speculative. I mean, there is some science about the impacts of cannabinoids on menstrual cycles and getting pregnant and birth outcomes and long-term sequelae of those offspring that may lead to diabetes and obesity. I mean, the cannabis, it undergoes what's called methylation of multiple genes, even the autism gene. So there was a paper from one of our other advisors from Australia showing that autism spectrum disorders were higher in marijuana states than non-marijuana states in the United States. And, Robert Kennedy just had this big thing on, we're in the middle of an autism crisis. Well, that kind of correlates with these expanded marijuana programs. So you have to wonder. I mean, I can't prove that, but there's definitely a strong correlation between this transgender movement, increasing marijuana use. I just wonder. Nobody's has the capacity to do the research because it would be too complex. I mean, I just think the factor that people tend to ignore. Again, it's the girl at the dance nobody wants to ask, but she's always there, but she's ignored all the time. And I just wonder about that relationship. But yes, the data is pretty clear that LGBTQ population tend to use substances more, including cannabis. I think I sent you a stat that cannabis is the highest substance that they use of others, and they are more likely to commit suicide or have suicidal ideation and behavior.
Yeah, which is interesting. And I think, too, the silent factor here that we probably overlook too much, maybe we should be talking about this more, is the marijuana lobby itself and how influential the marijuana lobby has been in shaping the way that everyone thinks about this. I mean, like I said, when we talk about this, I feel no animosity for the people in the live chat who are telling me that I'm wrong, because I'm like, 10 years ago, I thought the same way. I never used marijuana, but you hear these things in, you don't even know where you hear these things. Like that's an effective advertising campaign. That's an effective way to change people's minds. If people are like, well, I don't know how I formed that thought. I don't know where I learned the stereotype that marijuana's fine. It's just chill. Like, don't drive when you're on it. Like, where do you learn that? Really effective indoctrination means you don't actually know where you learned that stuff. And so I was like that too, with a lot of this information. But the marijuana lobbyists, I mean, pulled off this enormous nationwide change of mind on marijuana because, 50 years ago, there was incredible stigma and there was a recognition of the harm. But these same marijuana lobbyists today are pushing President Trump pretty hard to reclassify marijuana as a less dangerous controlled substance. I don't know what the president's thoughts are on this. I know that I've heard him, or I've heard a lot of chatter around this, but what would your message to President Trump be on this matter?
Well, before I get to that, you bring up a very interesting point regarding the power of the marijuana industry, and I'm going to call out an organization called the AG Alliance. I don't know if you've heard of them before or not.
Yep.
The Attorney General Alliance. They had a conference in Hawaii on Maui several years ago, and they were entertaining the AG Alliance conference. They had all across the country. The cannabis industry was present at the AG Alliance. I gave a presentation to the AG Alliance on Zoom probably in 2022, 2021-ish. There was no scientists at that conference. There were no medical people at that conference. I asked them to go and speak at their conference, and I was stiff-armed. I was refused. They actually had a conference in Colorado Springs last year. And I asked them, I said, you're right in my backyard. I will come there. You have to pay for airfare, hotel. I will come and give you a presentation on cannabis. And they refused me. So the AG Alliance, our Attorney General Alliance, has the back pocket of the industry with them. So there's definitely a lot of political power and clout behind this industry. And they are influencing our policy. And I think policy should be influenced by science. Not by money, not by lobbyists, but by science, and not by anecdotes. Yes, I had patients say, "Well, it makes me chill, makes me sleep." But is it okay if somebody comes in and says, "Well, I drink 3 glasses of wine and that makes me chill and that makes me sleep too," or I take a cigarette, keeps me from getting fat. So there's all these things that the same argument.
Yeah.
Why is marijuana being treated so special? I mean, as a medication. Because I was actually one of the 25 people that's supposed to testify at the rescheduling hearings. I don't know if you knew that or not.
Oh, I don't know if you told me that or not.
No, there were 43,000 submissions on the rescheduling last spring when they opened up for public comment. And out of the 43,000 submissions, they picked 25 people to testify in rescheduling, both pro and con. And I was the only physician selected in opposition of rescheduling. And there's a lot of reasons why it should not be rescheduled. It has not been approved by the FDA for a single medical condition, right? If there's a high potential for abuse, there's harm. It's not generally accepted in the medical community. It's not commonly accepted medical use, or CAMU is what we were referring to. So I was ready to roll and testify, saying this is a bad idea. So if I had President,
what happened? Are you not scheduled to do that anymore?
No, those were put on hold. The hearings were supposed to start the day after the inauguration this year, but I think there were some things that had cropped up, so those have been put on hold. I'm hopeful that if President Trump wants to revisit rescheduling, I don't think he can do it unilaterally. I think the hearings would have to start up again, and I hope that they do. If it boils down to that, and I'm more than happy to testify and share my knowledge as to the reasons why it should not be rescheduled, especially in this day and age. I mean, somebody that took a shot at him may have been a marijuana user. He just went through D.C. saying we have so much crime here. And did you know in Washington, D.C., you do not need a physician's supervision to be a medical marijuana patient? You can go to a kiosk and say, I have a headache. Boop, there's my pass. I mean, in Colorado, I was curious. I got my medical marijuana card in 60 seconds. There were no questions asked. I mean, I have some medical orthopedic issues, bad knees, et cetera, because I'm getting old. But in a minute, I was approved. And I got my renewal the following year with no fanfare. And I was approved for severe pain. And I don't even have severe pain because the doctor never asked me my pain level. I mean, the medical, like you mentioned before, the medical marijuana is simply the entree to legalization. It opens the door. And that's the end game.
Yeah. Yeah. And by the way, I know I've made this point before, and I want to repeat it just to speak to some of the comments of the viewers, of you guys. The people who say, listen, I smoked weed in my younger years and I'm totally fine. Remember, too, I think this is a really important point to make, that smoking marijuana in 2025 is not the same thing as smoking marijuana in the 1970s. It's almost not even related. The amount of THC, which is the psychoactive component of cannabis, is 5 to 10 times higher in concentration now compared to, not even 1970s, just 20 years ago. So it's a whole different ball game. So yeah, you probably
different beast. And actually, the potent products are nearly 1,000 times stronger. Not
oh my word!
These are like nearly 1,000 times stronger. And they don't even look like plants. They don't look like bud or flower. I mean, you get into the concentrates and the dabs, waxes, and shatters of the world. I mean, just taking a hit off a dab on a dab rig is the equivalent of taking, hits off 50 1970s joints. And back in the day, they used to share the joints. That was low potency, right? They pass it around. You take a hit and you pass it around, and by the time you get a second or third hit, it's gone, right? Now,
Yeah.
these dabs is one hit, one person with very potent product. And interestingly, CBD, which is kind of the stepchild of THC, may actually have a protective component, a neuroprotection component to it. So the problem is that the gap between the amount of THC and CBD in the product has widened so much that there's really little, if any, neuroprotection with the CBD in those types of products. And CBD actually has its own baggage. For example, CBD alone has over 620 drug interactions, some of which are
Whoa.
common over the counter, things like Tylenol and ibuprofen. You may have an increased risk of liver damage with these types of medications. And most of the doctors don't know this. This is why I speak almost monthly to medical groups. I spoke to MD Anderson Cancer Center 3 times, UCLA Medical Center, VA. I speak to grand rounds. I speak to doctors, cardiologists, psychiatrists. They don't even know. If the doctors don't know, how does the general public have any idea of what we're dealing with? And I agree with you. I mean, I had a lot of libertarian friends in Colorado that have buyer's remorse now. They go, because I get these arguments with them at the gym and saying, this is going to happen, psychosis, driving fatalities, all this other business. And they're like, no, it's what's the big deal? I think it's a right to try, right to use, which, I don't care what people do in the privacy of their own home personally. But it's just simply from a medical and scientific perspective, another addictive substance that is causing problem, especially to our youth, especially to the unborn. And that's a whole other discussion I'm more than happy to have with you at another time. But he came back to me and said, you were right. That's a hard thing for a libertarian to say, to like, you were right. And he goes, if I'd known now what you were saying, then they would not have voted. He would not have voted. And my other libertarian friends would not have voted to legalize it.
Listen, it took me years to be able to admit that perhaps I had miscalculated on this issue. And I'm actually super open now about the other issues that I've changed my mind on.
That's
but it's human nature dictates, man. Right. It is not easy to say, I took this stance strongly, I even lived it, and now I'm changing my mind because I was wrong. That's a hard thing to do. Super hard thing to do. And I can tell you that personally.
I hope I'm wrong. I hope I'm wrong. Because if I'm wrong, I'm gonna disappear under a rock and nobody will care who the hell I am. But if I am right, and so far doing this for 20 years, I have been right. We like to be right, but I'd rather be wrong in this space than right. Because right now we are seeing a significant amount of public health problems that are occurring right under our noses, and people aren't paying attention. They're like, well, Westman's killed a couple of kids, and he was transgender and worked at a dispensary, but they don't dig deeper saying, well, there's a link there. And then we have the case after case after case. The Uvalde shooter, we're still waiting for that toxicology to come out. And there's something there that you and I need to have a private discussion about.
Really?
I think they are purposely withholding the toxicology. And he was a known marijuana user. And actually, the New York Times they published something shortly after the shooting that he got into a tiff with his grandma or I think it was grandmother on his marijuana use. And within 24 hours, they removed that comment.
No, they did not.
Yes. And I can get you that information as well. I mean, there's something there that I don't know why, the guy is dead. The investigation is pretty much over. Just I think there needs to be mandatory drug testing on all these crimes, mandatory testing, and let the public know. If the stabber from North Carolina was negative, that doesn't mean he doesn't have cannabis psychosis, because that can persist. Remember?
So would that show up? By the way, I meant to ask this earlier. No, would that show up in his hair if it wasn't in his urine and it wasn't in his blood? If he had previously used cannabis and he was negative urine and blood, would that still show up in his hair?
It could show up in his hair if he was a chronic user. Yeah.
So we could still find out if he was. Well, here's my question. So the Uvalde shooting, and I guess it applies also to Thomas Crooks, if there was some process that the medical examiner typically used for testing drugs that they didn't use on isolated to Thomas Crooks. Very odd.
Yep.
What is your speculation about why that is? Like the New York Times actually use that as an example. Would they have gotten blowback privately from politicians who were bought off by the marijuana lobby? Would they have gotten blowback from the marijuana lobby itself because they rely on advertisements? Like, what is the behind the scenes power mechanism that would change the New York Times, their editorial decisions, but also change medical examiners' decisions of how to test certain people or not?
That's a really great question. As it relates to Thomas Crooks, I spoke to the coroner one time. I said, "Can you just retest it?" And he goes, "Okay, whatever," and he hung up. And then I sent email, and then they kind of punted. Well, this is an FBI case; it's out of our hands. And I called the FBI, and they hung up on me. It's like, so why would they do that? I said, I have evidence that there could be something that needs further investigation in Thomas Crooks, for example. But I think that all these, like Justin Moan from Pennsylvania, gave up his medical marijuana card, purchased a gun, shot his father in the head, cut his father's head off, and then posted a government rant on YouTube with his father's head. And I sent you the link to that video that you can watch at your convenience. It's pretty graphic. But I sent it to the DA. I said, test his hair. It may not be in his blood, it may not be in his urine, but test the guy's hair, because that's where the answer is.
Did they?
No, it's ongoing investigation. No response. So, I mean, that's why I think we need to have these mandates in these cases, like Bren Spetcher. I mean, they got her blood right out of the gate, and she had THC. And I actually have her victim, Chad O'Melia's toxicology report. He only had THC. They said, well, it must have been laced with something. It was synthetic THC. These products are very, very strong. This is not 1970s weed. These are causing mental health problems. I mean, marijuana is the most prevalent substance found in completed teen suicide in Colorado now. Why is that? It's not alcohol. It's marijuana, 30 to 40%. And it's not like alcohol is a close second. It's a distant second. And that trend changed around the time Colorado legalized for recreational use. And there's probably a bidirectional relationship. Kids are not overdosing on marijuana, but are they using because they're depressed, or are they depressed because they're using, right? But the fact of the matter is that it's the number one substance found now in the state of Colorado when a kid kills himself, which is tragically sad. A lot of states don't test. The state of Texas, which represents 10% of the U.S. population, does not have mandatory drug testing for suicides. So
is that something that needs to be legislatively mandated? Meaning, like, the state legislatures need to say every time that there is a medical examination after a death, you must get a sample, blood, urine, and hair?
Yes. And actually, in the state of Colorado, people that commit suicide or complete suicide under the age of 25. So you're talking about an adult. The number one substance found is still marijuana. After nothing, there might be nothing in their system, but the number one substance is marijuana. So why are all the arrows pointing at that girl at the dance? She's there, and nobody's connecting the dots. That's what makes it so frustrating for me, because I try to educate, I try to connect the dots and say, look, this is what I see as the evidence. There's science behind it. There's literature. I'm not the only one. I mean, the International Association for the Study of Pain published a position statement saying that cannabis does not help chronic non-cancer pain, right? And that had probably 50 to 60 different authors on that position statement. So there's just, I'm not the only person. I'm just the only person speaking out, and that's I feel like an army of one sometimes. But over time, I've connected, and that's why we founded Isaac, is to connect people and scientists and researchers and physicians to kind of come together and kind of explain and educate not only our medical communities, but also our general communities on the risks and impacts. We're not prohibitionists. We're not nihilists. We're not saying you're going to burn in hell because you smoke a joint. That's not the point. The point is we're just a resource. We're education, so people can make an informed decision about their own health. The one of my favorite speakers was Dr. Oliveira from Harvard, talking about the ADHD brain and cannabis as a toxic couple. Our daughter has ADHD, so she watched it, and it was fascinating. It was very easy for a person to understand this link between ADHD and cannabis use. And the interesting thing is the ADHD, we're seeing an increase in ADHD and autism spectrum disorders in kids that may have been exposed in utero. And it's not just the
Oh,
mom.
interesting.
That's the other thing. They keep pointing the finger at the mom. You're a bad mom because you smoke weed during pregnancy. And that may not be the case. Susan Murphy from Duke University has published some very nice information that the father's use can alter the autism gene. And mom may be completely clean and they have an autistic child. But
So if the dad smokes marijuana, gets the mom pregnant, it can potentially lead or contribute. It's a contributing factor to ADHD and autism in the child.
Yes.
Unreal. So is it that the cannabis in the father impacts, well, obviously his sperm, but like genes in the sperm, or what is the mechanism?
It's the autism gene. Like I said, the cannabinoids, they cause what's called demethylation of genes. And actually, I read a paper about a month ago. 12,000 genes undergo demethylation with cannabinoids. 12,000 different kinds of genes. And actually, that's why the paper showed recently the trajectories to those exposed offspring might lead to future obesity and diabetes and heart disease. And I'm like, what? This is all news to me. So if I just know this, nobody else, I mean, doctors don't know this generally, and the general population doesn't know this. So cannabis has an epigenetic impact. And so there could be organ defects. There's Stuart Rees from Australia published a gigantic book on the epigenetic impacts of cannabis, leading to birth defects and autism and ADHD and all this other stuff. The country of Canada recommends that men of childbearing age don't use marijuana because of the reproductive effects.
You're kidding.
No, I'm not kidding.
This is mind-blowing. Listen, I always describe myself and, all of the people with us today as happy skeptics. Like we're here to pursue the truth, even if the truth is uncomfortable, even if it's mind-blowing. And I don't let the discouragement or, feeling demoralized by lack of faith in our public officials. I don't let that make me like depressed or black-pilled. Like I'm a happy skeptic. I'm going to question everything, but I'm an optimist because I think that we have incredible influence to make changes when we figure out the truth. And I feel like this is one of those topics. I feel like if we actually are committed to letting the data drive us and not ideology, I mean, again, everyone sitting here with us, you guys, post your comments if you have questions, if you have counterpoints. Like, I want to hear them. I want to investigate this together. Dr. Finn, we've been sitting here almost an hour, and it's felt like it's gone by like that for me because this is so interesting. This is exactly what I was hoping.
We barely scratched the surface. I'm more than happy to come back again and talk to you about any other topic. The child poisonings, the adolescent use and addiction, the geriatric population that are now, the older population is using more. Now in California, there's a 1,800% increase in old people going to the ER with marijuana poisonings. So, I mean, this is just again, the alcohol ship left the harbor, right? So did the tobacco. That they're gone. The marijuana ship is still in the harbor. We have time to fix it and make it better. And that's why I do what I do. People say, well, you're just a nihilist and and I'm not. I'm a scientist. I'm a physician. And my job is just to give people the information, especially like my patients. I published a paper on having conversations with patients for providers. Because the older I had a lady coming in, had arthritis in her knee, and she wanted to use CBD products. I said, well, what are you taking? She said, well, I'm on ibuprofen. So I went to a website called drugs.com and I put in cannabidiol, and there's a section you can look at drug interactions. I put ibuprofen in there. There's a moderate interaction with liver disease, liver damage, with taking CBD with NSAIDs like ibuprofen and meloxicam and naproxen and those sorts of things. And the patient's like, oh, I didn't know that. Nobody knows that. The doctors, her primary care didn't know that.
How come doctors, you mentioned that a couple times, sorry to interrupt, but how come doctors, you said doctors don't know this, you've talked to, the UCLA, VA clinics, you've talked to a lot of these doctors groups, and they're unaware of this. How come? Is it because the medical schools don't teach this? And if that's the case, why is that? Is that because they're captured by big marijuana, or what? Why is this? Explain this.
I've been terribly disappointed in the medical community. I've been terribly disappointed in the AMA. They need a stronger position on this from a public health perspective, public health and safety perspective. I've been trying to integrate cannabis in the medical school. You don't get taught this. It should be part of every physician's training in endocrine, in surgery. There's a paper about surgical patients. Some of my colleagues are starting to learn. They say you need to stop using marijuana because there's drug interactions with inhaled and injectable anesthetics. I can send you a nice video of a friend of mine who talked about how much propofol a cannabis user needs to be put to sleep compared to a normal person being put to sleep. It's significantly a lot. And those patients that are chronic users post-op have higher pain levels, they have higher lengths of stay, they have higher healthcare costs. The opioid and cannabinoid system are so intricately combined and intertwined. And as a pain physician, that's kind of the bulk of what I typically talk about is this relationship between opioids and cannabinoids because that's a whole other discussion. It's too deep and broad. But I've been terribly disappointed in my colleagues. They don't speak up. My friend Karen Randall from Pueblo ER, she ran disaster relief for the city of Detroit for 18 years and was never assaulted. She goes and practices in Pueblo, Colorado. She's been assaulted verbally and physically several times. And she says the stories that she can tell you about cannabis are just frightening. The stuff
everybody has those stories is the thing. And I know one of the points we made on the show is the plural of anecdotes is not data, but everyone has had that experience as well. I'll tell you what I want to do is I want everyone watching and listening today, I want you to think of your best question and put your question for Dr. Finn in the comment section, whether you're on X, whether you're on YouTube, whether you're on Spotify, whether you're on Apple, put your questions in the comment section and we'll have Dr. Finn back to address. If you had a counterpoint that you wanted to make, if you had a study that you want to say, well, what about this study? If you have a point of disagreement or something you want explored further, put it in a question, put it in the comment section. We'll collect the best questions. We probably won't be able to get to them all, but we'll collect the best questions and we'll have him back if he would be so kind as to join us, and we'll do a follow-up to this episode so that we can explore this in a more complete manner. Dr. Finn, thank you for your time. I really appreciate it. This was fascinating.
Liz, you're so welcome. And on that point, and this kind of circles back to the rescheduling issue. If there is a topic that is so divisive, because you have a camp over here and you have a camp over here, since if there's no middle ground, why would we even consider rescheduling it? There's no middle ground. I mean, there's no overlap. There's no Venn in the pro and con in the marijuana space on rescheduling. It's either you're against it or you're for it. If it's so contentious, why are we even leave it where it is for now, right? Until we get the better science. I mean, there's been already 8,000 studies on marijuana at the taxpayers' cost of over $4 billion, despite its current schedule, right? It's well studied. People are studying all the time. But anyways, I'm more than happy to come back. I really appreciate you taking the time. And again, if you have a follow-up questions or email about some of the things I discussed today, just shoot me an email or have Spencer shoot me an email, and I'll follow up with graphics, links
Definitely.
to papers.
And then for the viewers too, is there a place on social media that's best to follow you or find your work?
I would go to Isaac. It's isaac1.org. www.iasic1.org. That's kind of a link to we have a limited library because there's so much information out there. We don't want to overwhelm people. We have it divided up in ER, medicine, psychosis, all this other stuff. The link to Carson's paper from Denmark on the causal relationship between cannabis and psychosis is on our website. So we have a lot of information. I mean, I personally don't like social media because it's a war zone, as you know. So I do a lot of data mining. I get papers off of X. My colleagues are posting and talking about this. Isaac posts information on updated papers that are coming out. So I think it's important that people do their research. Again, I'm not really a pro-con person. I mean, I know I sound like a nihilist, but I'm a physician.
No, you're saying you're not an activist. You're a scientist, and I think that's clear. Although I'm sure there's still going to be some people who think that you're an activist. But what can you do?
What can you do?
Okay, thank you, Dr. Finn, for being here, guys. I want to take a moment to thank you too for watching and listening to this episode, especially. I gave the context at the beginning. Anytime that I talk about this, there's a lot of pushback, and I respect your views, and I listen and I read to what you're saying, your experience. on this topic and on every other topic. That's what makes the Liz Wheeler Show community so amazing. It's what makes Blaze TV so amazing. It's because of you that we're able to keep producing content like this. Blaze TV exists because people like you refuse to settle for, pre-constructed narratives, watered down coverage, endless spin, clickbait headlines that mislead them instead of inform them with the truth. Now, Blaze TV has never been about just one voice or one company. It's about a movement of people who refuse to sit on the sidelines and are willing to take a stand when it matters. That's why Blaze TV matters. By subscribing, you are standing shoulder to shoulder with a community who believes America is worth fighting for. Blaze Media only exists because people like you step up, join us, and help drive this mission forward. When you subscribe, you're not just supporting a show, you're making your voice count. You're ensuring that truth has a platform today and for the next generation, because we aren't just sitting here chatting. We are impacting policy. We are impacting people. Join Blaze TV today at blazetv.com/Liz and get $20 off right now. For as low as $8 a month on the annual plan, you can be a part of shaping the future. That's blazetv.com/Liz. blazetv.com/Liz. Thank you all for watching, for listening. I'm excited to read everybody's comments. As I know you're going to be commenting on all the different platforms, I'm excited to go in and look at all of your feedback. Make sure you're subscribed to the show at youtube.com/Liz Wheeler, x.com/Liz_Wheeler. On Spotify, search for The Liz Wheeler Show. Hit the subscribe button. Leave us a 5-star review. I'm Liz Wheeler. This is The Liz Wheeler Show.